Join me, Susan Regan, host of Connecticut Valley Views, the most widely watched interview program on Connecticut Public Access TV. Proof to the people is the byline, insight without bias, generating a 360 perspective. Our mission is to focus on topical subjects with thought-provoking interviews regarding municipal leadership, current affairs, educational and political topics, as well as key destination points in New England.
And here's your host for Connecticut Valley Views, Susan Regan.
Hello, and thank you for joining me today. I'm going to be talking about a subject that I think is most important. It is dental health, and I've covered a lot of subjects in the health field, but this one really includes everyone, from children to older adults. And my guests today are Dr. Karina Goikman, and she is the Doctor of Implant Dentistry and Periodontal Plastic Surgery, and Dr. Kenneth Andres of Salmon Brook Dental Associates in Granby, Connecticut. It's a pleasure to be here with both of you.
Thank you.
And hopefully we're going to be imparting some information that's going to be beneficial to our folks out there and our viewers. All right, Dr. Goikman, a brief background. How did you get into dentistry? Was it something you always wanted to do from a little girl, or someone gave you an entree? Tell us a little bit about that.
I always knew I was going to be a doctor from a very young age. The question was which type of doctor. My father's a dentist, so I spent many years in the office, working there, and
So you became acclimated to the whole thing?
it was a very comfortable environment. People would come in, just talk, and it was very friendly. My mother worked there, so it was a very nice atmosphere. You really felt that people were being helped, and it was something that I wanted to do when I graduated. So I went in his footsteps, and I attended NYU, which is where he graduated from, and then I continued on and got my periodontal certification there as well. So I'm a board-certified periodontist, and I concentrate on the areas of implant dentistry and periodontal plastic surgery.
It's very interesting because I actually interviewed a woman at St. Francis, a doctor at St. Francis, and she's in the new women's health care center that they have down at St. Francis. And I said to her, how many women are in surgery? And she said, well, that's an interesting question because not very many women are in surgery. Now, this may not be quite exactly where she is, but still, this is surgery. Are there many women surgeons in dentistry?
There are not many women surgeons in dentistry, although the profession has changed. So there are many women in the field of dentistry now, as opposed to maybe 30 years ago or 20 years ago. Not that many go into surgical aspects of dentistry because it requires significantly more training after dental school.
Sure, a number more years.
So it can be, challenging. So you don't find that there are many women periodontists or surgeons.
Dr. Andres, how did you get into it?
Well, I had a family dentist who was influential, and I used him as somewhat of a role model, and I always liked biology, and I was heading into the medical field, and I chose it as a way of becoming somewhat independent in my profession, and it affords that.
Was it a sense of wanting to help people?
Yes, of course.
Is there a sense of
all of us are like that.
making people feel better?
Sure, yes. So after college, I went to dental school. I graduated in '81. I decided to go in the Air Force, and I went to general practice residency, and I was at Keesler Air Force Base in Biloxi, Mississippi for the first year, and then I was in California for 2 years. And then something pulled me back to the Northeast, and it was mainly family, so I came back, and I found a practice in Connecticut in Plainville, where I worked for 2 years, and found a niche practice up in Granby, where an older doctor was retiring, and
that's always a good changeover kind of thing, a transition.
Sure. It was interesting because the equipment was very, very old at the time, and but we upgraded the practice over time, and it was exciting, nerve-wracking, but exciting, and we built it up, and I've been in Granby now since '86, so almost 30 years. I can't believe that.
Well, the time goes by, and I think the fact is that people get to know you, and I think there's a lot of reference, and there's a comfort level in references, and I think that works well.
Sure.
Now, there have been some great strides made in dentistry, I'm sure, in the surgery end of it, and what I kind of view it this way. Objectively, I sit back and I look at you as the primary care physician, and I look at you as the specialist. Dr. Goikman. So strides for you, Dr. Goikman, what have you seen that's changed? And what's the major change in surgery?
I think implant dentistry really is a life-changing area. It affects people tremendously. We've come a long way from where implants were originally, the way they were developed and created to where we are now. And it makes a huge difference in a person's life because they are fixed. People are able to restore their mouth to where they had been originally as best as we can. And you don't have something that you have to take in and out of your mouth, which makes people feel aged. They're not.
Yeah.
They're less likely to speak to you. They're less likely to communicate. There's a lot less stability in the mouth, and it really affects people psychologically and how they
Right.
function in society. And we are human, and we function in society, and people need to be comfortable. And they're very successful. Really, we're at 95 to 98% success, probably closer to 98. So there've really many advances in the way this field has developed, because there's just such a need for it. We have a very large, older population
Certainly.
that has had dentistry in the past, so it's changed tremendously. So many people have had a lot of dental work done that is, failing just through time. If you think about how long our teeth are
There's
in
a
our
fear
mouth.
factor, people just keep putting things off.
People do keep putting things off. There is a fear factor. I have to tell you from personal experience as well. I had a very bad experience as a child, and I was very much afraid of something, which for me was a reality. It's not, it's manageable, but people don't realize that. And it's very important to understand what a person's fear is, because it's not the same for everyone, to understand how to address that fear, and to basically create an environment where they can feel comfortable on a consistent basis.
Actually, almost to want to go to the dentist because you're sort of enjoying the experience where I'm going to
right.
get my teeth clean, I'm going to look better, I'm going to feel better.
That's right. You want it to be that they have positive experiences consistently, where so eventually
Consistently, I
consistently,
see
where
that.
over
I agree.
time they're coming in frequently, because prevention is really the best policy. It's the most important thing that you can do for a person, is to
I think
prevent
that-
disease from happening.
Certainly, and I think the relationship, and I think that's important, wouldn't you say?
That's
What,
right.
what would you see as an advancement? Because the relationship between the patient and the doctor is important on your general health. I think it's just the same when it comes
Absolutely.
to dentistry.
Well, no matter what, most people walking in here would rather be somewhere else, and we realize that. But we try to make the best of it,
Sure.
and with an honest effort, and we try to comfort people and explain,
What you're
everything
doing.
that we're doing and the reason why, and people will accept that. I mean, that helps a lot. One of the biggest changes that we've seen is the technological changes that have occurred, and we're now in a paperless office.
Is that a boon or is that an
There's
issue?
a double edge to it in a
Okay.
sense, because
Okay.
you would think that with a one-write system, typing
Right,
notes, it takes a lot more time. Actually, it takes a lot more of my time instead of scribbling notes on a
Right.
piece of paper, which sometimes are illegible, which is an issue.
That's all right,
of
you're a
course.
doctor, we understand that.
But everything is legible now and detailed, and for instance, prescriptions are highly, everything is accurate. The other aspect of technology is the radiography systems that we have now, which are digital, which is quite a big step in the right direction, because now we have instant imaging that are highly accurate images that we
So
can.
it shortens up what you're going to do. And
Makes
how
a
to-
huge difference.
Yeah.
Yeah, there's no more time. The 10-minute time it takes to develop an X-ray
Sure.
is no longer a factor anymore. And we can change the image, we can change the contrast, we can change the size. I know Dr. Goikman does measurements for her implants.
can manipulate things.
With her graphics.
It made a huge difference, especially with a lot of people being concerned about radiation.
Sure.
The digital radiographs are very fast, so there's very minimal radiation. The beams are very directed. We have tools now where we can aim the machine specifically to the area that you need at exactly the correct setting to not have to redo anything. And so it really limits what you're doing, and it really speeds up the chair time. So patients are in and out of the chair. Procedures are done much quicker healing time. Everything's much faster and much more beneficial during and after.
So I think the point we want to make here is to take some of the fear out of here for our viewers, is that there's expediency, there's more efficiency, and it's a good segue to the question about pregnancy.
Yes.
People worry about X-rays and too many X-rays and women being very pregnant.
Yes.
Is this a big issue, doctor?
It should not be. Actually, the ADA has new guidelines concerning pregnancy, and there's no more restrictions about taking X-rays. Although there are times when we could put it off, but
Yeah.
there used to be almost it was almost verboten to
Avoidance,
ever,
yeah.
unless you absolutely had to.
Right.
But now, the amount of radiation is so small. It's a very, very small amount, and it's very constricted to the area. The filtration is such that it can only it doesn't scatter to any
Certainly.
great degree.
Certainly.
Pregnancy is a big issue. Women should have their regular dental care. That's very important.
I'm sure even their
Yeah.
primary care, or their gynecologist would say
Yes.
that to
Oh,
them.
sure.
I
Yeah.
imagine that this is a time
Good health.
especially when women
Right.
should be coming in and taking care of their health, certainly from a periodontal perspective.
Mm-hmm.
Research has shown that women who have uncontrolled periodontal disease are potentially
Oh,
at a
harming-
greater risk for
Absolutely.
preterm babies or low birth weight babies. There are certain periodontal lesions that are specific to pregnant women. So for them coming in for their maintenance and recall visits to make sure that there are no problems, that they're being taken care of, is of utmost importance for the health of their own health, but also for the health of their child.
Is it an old fishwife's tale about losing a tooth for every baby you have? Obviously, if you're not taking care of your teeth, you might, but
Well,
yeah.
officially, there's been no research to really nail that down and say that, well,
Yeah.
pregnancy leads
Right,
to
right. Losing
increased
teeth,
decay
right.
rates, but my experience is that it does. And it could be due to habits, changing habits,
Yeah.
maybe.
Change in diet.
Right,
Change in
exactly.
diet.
And women only want to have
They're
ice cream and pickles, so it may not
tired,
be the
you know,
best thing.
there's different things, I think, also
That
for women
affect
who are
it.
pregnant. They have other things on their mind, maybe other than their mouth.
Right.
It's, you know, you're having a human being growing in your body. It really quite affects you as a person.
Well, let's transition to the next question. Now you've just had this baby and you've got a child now.
Yes.
What age group are we talking about?
Well,
Where should
officially, the American Academy of Pediatric Dentistry says that children should be seen at age 1, at 1 year old, which is
or their first tooth.
What are you looking for at age 1? Teeth
Or their first-
coming in?
basically you're looking for abnormalities.
Yeah. Okay.
And but it's important to reemphasize with the mom or dad that home care is real important. And one thing to avoid, of course, is and we see this even in today's world, is the baby bottle syndrome, which involves rampant decay of teeth, and it's usually due to the fact that children will have a bottle in bed, with
Oh, something always stuck in their mouth.
juice or
Right.
something sweetened.
That's acidity.
That's right.
Right,
Right.
well, that, and then,
Sugar.
you could see some really bad effects from that. And to make the parents aware of the situation, they should only, after age 1, they shouldn't really have a bottle when they go to bed, if
Right.
that's possible. But if they do need something, just use water.
Mm-hmm.
Even milk can cause decay, if
Yes.
it
You
lays
think
in
you're
the
getting the
mouth.
calcium, but you're actually
Right,
causing
right,
issues.
right.
Yes. Everything good has a limit.
Does
as long
this
as you're not
bring us to
overdoing it.
fluoride? What are some of the prevention things?
Well,
Fluoride's
fluoride
important.
is huge, and that's it's been 70 years since water fluoridation was started, and according to what I've read, in Connecticut, 75% of the community water systems have fluoridation. Although in Hartford County, there's hardly any, and
Really?
well, MDC is a big one. That's one that has it.
Really?
MDC. I don't know what the percentage of the population that they serve, but the local water system in Granby doesn't have it. The aquarium system in Simsbury doesn't have fluoride. It's expensive for a small company to have the program. It costs more, per person to have a fluoridation program. But at any rate, we've seen some great decrease in tooth decay simply from the fluoridation programs. We also receive fluoride typically with toothpaste. Toothpaste is fluoridated, and there's a lot more emphasis
So
with
is that something you
rinsing.
should look for on your label? Or?
Yes, yeah, I would.
So it'll say enhanced with fluoride or
Yes,
something?
and most do have fluoride.
Okay.
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 So the decay rates, tooth decay is not necessarily a given in life. It used to be thought that way, tooth decay is just something you had to deal with, but we see many children without decay, and there's all kinds of preventative things that we do. We do fluoride treatments in office. If they don't have fluoridated water, which is often the case in this area, they should be on fluoride supplements, to age 16.
So what is that, tablet thing?
Tablets,
Tablet thing?
typically,
Okay,
yeah.
so toothpaste, tablets, regular visit to the dentist, So if
Right.
you see them at age 1, then what's next? What age do you want to see them again?
Well,
when?
generally cleanings.
I mean, if the teeth are coming in okay,
Yeah,
what would be your
we look for
normal?
abnormalities. Sometimes teeth can have issues, that we see readily. I mean, you can't really do much with a 1 or a 2-year-old.
Sure, of course.
Sometimes you can with it. Some 2-year-olds you can, but
Yeah.
and then by age 3 they have their baby teeth, typically all of them, and then we start their routine care in the office, and
See, now this is, and I don't want to interrupt you, but see, this is the important part, is making sure they have a good experience.
That's right.
Because
Oh.
you start
That's right.
remembering things about
That's right.
age 5 or so,
Right.
maybe
Yes.
3 you won't remember, but still, it's a little bit like when you take your pet to the vet, they recognize where
That's
they
right.
are, and the dog starts to get nervous. The
Exactly.
children come in and they're 6 and they're wondering why they're nervous, but it's
That's right.
something has happened and it's back there and they're
It's in
remembering.
there somewhere. The experience is important. So even at a young age, if you're not necessarily doing active, tremendous amount of work or cleaning their teeth in a certain way, they're coming in, they're having a positive experience. And so
And
when
then
they
you
come
wanna
in at
take
1
care
year,
of their
they still have a
teeth, yeah.
positive experience. So by the time they're 3, they've been here several times, they have a positive experience.
Yeah, yeah.
Experiences consistently are very important. And so they get used to coming to a dental office.
Yes.
And they're not worried about it, and this stays with them through their adulthood, actually.
Right.
Their experience as a child.
Right.
So it's very critical to have a positive experience. And I find that I see patients who were afraid as children who've been taking their children consistently, and their children have much better oral health and are much more comfortable and are happier, and will probably lead to them having better
Well,
better
it will
oral health
lead
as
to
adults.
them going to the dentist
That's
on
right.
a regular basis once they're responsible for their
Correct.
own welfare. Well, talking about this fear thing, people have been afraid to go to the dentist. What can you say that can reassure? Let's talk a little bit about the pain thing. People come in, they're afraid of the pain. Are there any updates in what you give them when you put the anesthesia, or you put people under for certain things, or you get local, whatever?
There's so many things that can be done
A lot of
for
things that can be
patients.
done to make it more comfortable. What?
They really are. We have, we have the nitrous, which really works well for some people. They can be given
Is
oral.
that the laughing gas?
It's
Yes.
considered laughing gas.
Okay.
Sorry.
Does it really make people laugh?
Yes.
Oh, it does
it,
make
it, it really it affects your nervous system. So
I see, okay.
it inhibits.
I see.
De-inhibits it. So also you can get some oral medication. For some
Okay.
people, works phenomenally well. It really just
You actually
calms them
swallow
down.
it?
You take it the night before.
Oh.
Then you take something that morning. Usually you have to have someone drive you.
Yeah.
But it's a day and night. It makes a huge difference.
Wow.
They're functioning.
Yes.
Patient's comfortable. They're functioning, but they are calm. They're happy. They're relaxed. They don't have a
That's very
concern in their mind. It really makes a huge difference for some patients.
So who would you recommend that for? Someone who has an absolute
People with anxiety,
It's
anxiety.
a very real thing.
It's a very real thing.
Very visceral.
It's very
Yeah.
stressful. It's a fight and flight response to a maximum, and it's such a stressful
And
thing for patients.
a lot of people can't consciously
It's
get
very
over
difficult.
it.
And some people are afraid
very
of needles.
understanding.
Very much so.
Very much so.
There
yeah,
are,
yeah.
there are different types of anesthetics. A lot of people call it the Novocaine. There are many advances. We have different types of anesthetics that work very quickly. So the pinch that a person feels is gone in almost a second.
Sure.
We also have a lot of creams that we put on beforehand that are very, very strong, that numb the area to such a degree that oftentimes patients will not feel the pinch.
So,
So they're quite advanced.
This is just a wonderful whole new world to hear about this,
Yes, it
because
makes a huge
I
difference.
think from 50 years ago in dentistry to where we are now,
Oh my goodness.
it's an entirely different thing, and this is one of the
Entirely
points I
different.
want to get across to
Yes.
our viewers, that this is a different experience. This is a different opportunity for you to not only be healthier, to look better and feel better about yourself. And I think this is very encouraging.
It's very gratifying as a practitioner
It is.
to help
Yes.
someone overcome this issue. And it never totally goes away, and we recognize that, and we help people to get through it.
No, I think it's tremendous. All right, well, let's talk to you, Dr. Goitman. You two obviously work together. There's a point at which you need to hand off, depending on what the situation is. So, Dr. Goitman, the bone replacement thing, when is it determined that you think, how do you work together to make this better for the person?
Well, we could have a situation, for instance, where a tooth may have bone loss, and there comes a point where a decision has to be made whether the treatment can be rendered or would it be better to consider removing the tooth? Okay, if it's it's a fine line sometimes, but Dr. Glickman can take it from here. But she would often be the decider, that would look at the situation.
You look at the X-rays.
Right.
You look at the.
You have to take a look at everything. You have to take a look at the patient's risk category. Are they a high risk for, let's say, caries, cavities? Are they low risk? What are we really accomplishing by trying to save the tooth? How much longevity do we have if we're going to put all this work into the tooth? Are we affecting the teeth that are neighboring teeth by trying to save the tooth? Does it make more sense to take the tooth out and replace it with an implant and not have to touch the adjacent teeth and cut them down, because teeth are natural living organisms.
Yeah.
Once you cut it back, nothing will replace it really. The tooth
Right.
is the best thing to have in your mouth, but sometimes you need to take a tooth out because you're just going to cause too much damage.
Right.
The implant needs to be positioned with the end goal in mind, meaning where is the crown that the patient is going to, you're going to see in the mouth that the patient's going to function with, chew, aesthetically. And so you need to put the implant in a position where the crown will eventually be seated on the implant.
I see.
So oftentimes, why do patients need their teeth taken out is because of disease that may contribute to bone loss. And we can't just take out a tooth, let the bone heal, and put the implant in where the bone is. It might not be the ideal position where we want our final crown.
To coordinate with the rest of the teeth. Okay, with the bite.
Exactly, with the
Okay.
bite. And that's where you put bone in. You need to have the implant has to be completely surrounded by bone. So you need a certain height, you need a certain width, they have to be, and you can't put any type of implant in. It has to have a certain size, depending on the tooth you're replacing. And once you take the tooth out, the bone loses blood supply from the tooth. So the blood supply to the bone is the actual tooth or the surrounding structures of the tooth. And once you take that out, the bone shrinks. So the bone grafting takes on different means, but
Forms.
that's right. It takes on different forms, but part of it is it maintains the dimensions that you want. So eventually, when you go and put your implant in, you're putting it in the right place, not just an arbitrary position where the bone is located. It has to be angled properly, because the implant, once it's integrated in the bone, it's extremely finite. It doesn't come out. It's integrated in the bone. It becomes one solid unit.
Certainly.
So you want it positioned in a place where it's going to function and aesthetically be appropriate, because you can't take it out. You could, but you're not going to want to take it out once it's integrated, and you want it to look the way it's supposed to look, and function the way it's supposed to function.
And have the person feel good about their bite.
That's
because
right.
What might look okay or seem okay, or what you see on the X-ray, the person's still going, no, it just feels a little.
That's right.
And you've got to accommodate all of those things.
Of course, because ultimately it's the patient's satisfaction that will tell you the success of your treatment. So if the patient's not satisfied, functioning or chewing or appearance-wise, you're really not where we're supposed to be. So we have to really control that as much as we can prior to the final place. So you really have to know where your final goal is.
I guess my next question, too, would be along with that. I think about bone disintegrating over a period of time, and not necessarily missing in a younger person. So what would you say that contributes the most, Dr. Andres, with regard to why things go wrong with older people? It's because they haven't been taking care of the teeth? Is it nutrition? What is the greatest cause of a problem, say, a person who's 50 plus?
Well, oftentimes we see patients for the first time at that age, and for one reason or another in their life, they hadn't been getting regular dental care, and we see various stages of periodontal disease, and hopefully without a lot of bone loss. In that case, some treatments can be done that are very conservative, that can help the patient manage what they have. Oftentimes there's ample bone, even though it's not ideal. And with a home program and an office program, we can keep and maintain basically the level of bone that they have, the support of their teeth. And it's very important that we try to stay on that course. Unfortunately, there are some cases where the bone loss becomes a matter where we can't really practically keep it under control.
Right.
And in that case, we have to consider replacements. But very often we've had very big success maintaining people and keeping them on course. And
Well, that's good to know.
Yes.
Yeah.
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 Maintenance is really the most important thing, actually.
Right.
Yeah.
For
And also in viewing them,
Yeah.
recognizing what the cause is,
Yes.
and
That's right.
it's and that's part of our job, is to educate people and inform them of what the process is all about. Periodontal disease oftentimes fools people because it doesn't cause overt pain. You know, a lot of people will feel some irritation. There could be some bleeding, maybe a taste coming from an area, even odor sometimes. But it's not a very overt thing. Like if it's that serious, you would expect it to cause pain, but it doesn't necessarily do that. And unfortunately,
it's not really a painful disease at all.
we see some people in a very late stage, you know, when it's almost too late.
It's almost too late.
Yeah.
So,
That's right.
but people usually notice loosening of teeth.
But by
or,
that time, it's pretty
yeah,
far.
it's pretty far along.
gone.
It's pretty far along. Well, just quickly, I want to ask you, what do you think about people having these dental insurance and stuff? A good idea, bad idea? I mean, what's
Well, if you're an individual trying to get a plan, the dynamic really isn't good because the insurance company doesn't want somebody to latch onto a plan and then have all their dental care taken care of and only to see them dropped. If you're part of a group, the dynamics are different.
Yeah,
you
you've got
know,
an employer
it's-
covering everything.
Right, right. So it's a whole different thing. There's a lot of things in dental plans that are hard to understand. There's limitations of coverage. They use a fee profile that may not be correct. There's some major services that wouldn't be covered in the beginning. You might have a period of time when you need to, you have to hold on to the policy before they will cover these major services. And the limitation of coverage is always there. So for an individual, it's often not, it doesn't
Especially
really,
later in life,
right.
when you need lots of big things done.
Right, right. It's really not good, you know, mostly. But in our office, for instance, we help people if they have a plan they're looking at. My staff can help them look at it and understand it. Just real quickly, I had a patient who came in and expecting to have coverage on a procedure, and I had to inform him that there wasn't
you're
coverage.
not, yeah.
But he was the person in the company that actually drew up the plan with this
Really?
insurance salesman,
Oh.
and he was quite amazed. It's a very, very tricky thing to look at.
Yeah, I think
So,
you have to be very careful. It's a little bit looking at extended coverage on your cars, and you buy it and you figure you're going to be covered from bumper to bumper, and it turns out a lot of things
So
are
many
excluded.
limitations.
So
Excluded,
really,
right, sure.
really you're not looking at. Well, I know we have some information here we want to impart. We have some websites and some things that you've given. To be correct me if I'm giving this incorrectly, but we have one. It's www.mouthhealthy.org. So that would be a general
That's
review
the
of-
ADA website, and they have a lot of good information on many, many topics. And they have a menu you can pick from, and
Okay.
it's very good.
So that would be one good one. Then you could Google up what's my water fluoride. We've talked about the fluoride
Yes,
subject.
if
This
you're
is
on
good
a
for the children.
right,
and-
if you're on a water system, that will tell you how if your water is fluoridated or not, and that's very important to know because if you're not on a fluoridated system, children should be on supplements.
And this Connecticut water fluoridation information is for well water testing. So it's a
Right.
$20 fee. If you go to that site, you can get it tested and you can find out whether it's there. Obviously, you could probably ask your town, municipality, whether they
Well,
are or
actually,
aren't.
well water varies from
Well
well
water
to
would
well.
be. That's true.
Oh, yes.
No, you're
it's-
absolutely correct about that.
One neighbor could have, and one
You're
of the
quite
other
right, yeah.
concerns is you could have too much fluoride in your water.
Oh,
and
and that would be
Yes,
that would be.
that's a problem.
What would that do?
It's
What would
beyond
be wrong with that?
an optimal dose. It could cause what they call fluorosis. It causes
my.
mottling of teeth.
Yes,
So there's
destruction
a
of your teeth.
therapeutic level
Aha.
that's
There's
very
a point to
beneficial.
which
Right,
you
right.
want it. And
Yeah.
so
Everything's good in moderation.
isn't that the truth? Why does it always end up that 20-80 percentage of everything? All right, and then there's oralhealth.uchc.cdu. Well, it's been very informative.
Right.
I appreciate the
Thank
time
you.
you've given to us. Hopefully what we've done is reduce people's fear
Yes.
and really educate people and certainly encourage you to visit your dentist, find a dentist that you're comfortable with, and visit them on a regular basis and
Most
prevent a lot of issues. So I do
Yes.
want to thank you, Dr. Goyman.
you.
Thank you very much,
Very
Thank you,
Dr. Andres.
Susan.
We appreciate
It's been a pleasure. I want to remind you folks that you can see us on Facebook, and you can see all of our programs on ctvalleyviews.com. This is Susan Regan. Thank you for joining me and bringing proof to the people.